I am very, very, very grateful to the organizers, that is the Primary Healthcare Directorate, for organizing this event together with the Africa CDC and the UNICEF. My gratitude on behalf of the Ministry of Health is to you. I am not going to talk so much because you have heard from all my colleagues earlier on about everything else. How we came to be here today, how did we get the grant, who actually went ahead and procured for us. The grant that was given to us in form of donation is from Africa CDC. Africa CDC is an arm of African Union, the continent Africa, that deal with healthcare issues. And this generous donation of cold chain equipment is a testimony to our collective dedication to ensuring safe and effective distribution of vaccines across all levels of service in South Sudan and in Africa is achieved. We say thank you, Africa CDC. May you please clap for them. We have heard a little bit from our media, and I'm going to repeat it again. I made clarification a few days ago, a few months ago, a few years ago, and I will not be tired to say it. When we get donation, when we get grants from anywhere, either from African bodies or from international donors or from anybody, it doesn't come directly to the government institution. It goes through an implementing partner. And that implementing partner that we have is UNICEF. And UNICEF do not sit here and do procurement. It is done through their head office in Copenhagen, as you heard from our media. So there's a myth that any donation or any money that is heard from the media or pledge, it is in the hand and the coffers of the Ministry of Health. No. It goes through the UN system of procurement, it goes through the UN fiduciary system, and what we get is the end product like what we have here. I want to say that UNICEF has been doing a very good job since I've been in this ministry almost close to 3 years now, and they are very transparent. May you please clap for them. These resources that we have received will strengthen our capacity to store and transport vaccines under optimal conditions. And it's a very good thing that we heard testimony from the head of UNICEF in the country, that she went to one of the remotest places in South Sudan, and she found that we have very good quality vaccines available. That shows that such the donation that we get, that shows that the taxpayers' money of whoever is giving us that money to the government of South Sudan is not misused. It goes where it's supposed to be. And I will make sure under my leadership that no funding that is given to us is going to be mismanaged, because we are going to follow a transparent and a system that is testable, like what we have seen in the last few years. I would like to express my sincere gratitude to Africa CDC, my sister. Thank you so much for choosing South Sudan to be the first country that you visited once you took over the office. It's something commendable. On behalf of my government, on behalf of the government of South Sudan, on behalf of the health sector, on behalf of the people of South Sudan, we are very grateful to Africa CDC. Africa CDC made it very easier for me to lead this institution, made it very easier for me to be able to also lead East Africa region, because I'm also the chair of East Africa Health Cluster. All the time when we are struggling, like when Kenya was struggling with the flood of El Nino, when Tanzania had issues, right now Rwanda is struggling with Marburg and also monkeypox. Africa CDC step in, and each time that I call a meeting as the chair, we are always given support. Please receive our gratitude. The equipment, as we have seen here, and what we have here, by the way, is a sample. There's no point of bringing 65 plus all the accessories to be in this area while we have the rains. The equipment has arrived to South Sudan in excellent condition, and some of them are on display here today, as you have seen, and some have already reached to where they're supposed to be. I am confident that we will continue to deliver quality healthcare services that meet the needs of immunization from children to adulthood. Mama Mida spoke and the Secretary spoke in regard to all the vaccine that has been delivered, from the COVID-19 to yellow fever in Western Equatoria, to measles, to meningitis, you name it, to the routine immunization. This equipment here are the equipment that keep that vaccine in temperature that is needed and in safe condition for it to be used. As we move forward, it is about giving every child in South Sudan a chance to grow up to be a healthy and a strong individual of this country. Jamana, if we invest in our children, beginning of investment in a child or a human being is from when they are little. If we have got this strong investment, that means that we are going to have got a healthier population. A healthier population leads to a very healthier human capital. A healthier human capital leads to long life expectancy, which lead to a nation's economic growth. So it is important to look at what we are receiving here is going to be a very long chain of productivity in our country. I appeal to the public to take immunization of your family members seriously, seeing it safeguards against diseases, especially during this flood season. Our citizens should utilize Ministry of Health information output to stop the spread of diseases and also to protect yourself from infectious diseases and also to protect yourself from outbreaks. So it is important to utilize the official Ministry of Health information outlets. We have a lot in the community. We need to utilize, and I'm now appealing to our media. Please help us out, put the appropriate information out about health instead of us putting out like information that's going to create fear and labeling or stigma